continuing with the Solve the Problem series. This particular video is helping us to decode the identification of Kala Samprapti in an individual. Dear NA community members, press the like button and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching the right information at the right time for the right purpose. Continuing the Solving the Puzzle series, highlighting the importance of Kala Samprapti, the description in the textbook says, Naktam dinartha bhuktam shaihi vyadhikalo yathamalam. In the sense, so that Kala Samprapti is helpful in determining the time of onset of the presenting complaints or duration of the illness or age of the individual, etc., etc., or even the consumption of the food substances and its relation with that of the presenting complaints. All they are considered to be considered whenever we are dealing with the Kala Samprapti. So here the term Nakta refers to Ratri, Dina refers to daytime, Rutavaha refers to seasons, Chaitra, that is the, what do you say, that is the Vasanta, Grishma, Varsha, Sharad, Hemanta, etc. They are again of 12 different Masa, Chaitra, Vaishakha, etc. Each Masa they are having two Paksha, that is the Shukla Paksha and Krishna Paksha. So each Paksha is having 15 days. Each 15 days, whenever if you think about it, so that is having the, what do you say, that the day and night, having 24 hours. That is 12 hours each for the day and night. So in this way, we are going to decode the Kala as such. Plus, even we are going to decode the Kala in terms of, what do you say, that the Vyadhi also. Whether is it in the Sanchaya stage, or whether is it in the Prakopa stage, or whether is it in the Prasara stage, or Sthana Samchaya stage, Vyakta or Bheda stage. In this way, we are going to analyze this particular Naktam Dinattu Bhuktamshahi Vyadhikalo Yathamalam. So that means we are going to identify the time period where the person is having the aggravation of the symptoms. So that will be deciding the, what is it, the dosha dominance in an individual at that particular amount of time. The same thing is being mentioned in, what do you say, that the Arunadatta commentary. Naktam dinam cha rutushta bhuktam cha tani naktam dinartu bhuktani tesham amshaha avayavaha. So that means we are going to even decode the each points of Nakta, Dina, Rutu and Bhukta. So for example, early part of the night, we are going to expect Kapha dosha dominance. Middle part of the night, we are going to have Pitta dosha dominance. Late part of the night, we are going to have Vata dosha dominance. Early part of the day, Kapha dosha dominance. Middle part of the day, Pitta dosha dominance. And later part of the day, so that is Vata dosha dominance. So that is Amshaha. Rutavashcha. So in the sense, so in the month of, what do you say, that the Grishma, there will be Vata dosha dominance as such. Whereas in the month of the Vasanta, there will be Kapha dosha dominance that will be going to take place. In the month of Varsha Rutu, there will be Vata dosha dominance. In this way, we are going to analyze the Amshaha, Avayavaha. So in terms of the Bhuktamshaha, early part of the food intake, soon after the food consumption, there will be Kapha dosha dominance. Middle part of the food consumption, we are going to have Pitta dosha dominance. The late part of the food consumption, so that is after the food ingestion, the late part of it, that will be associated with Vata dosha dominance. In this way, so the timing or Kala will be helpful in determining the appropriate dosha involved in the disease manifestation, so that we can able to plan the treatment properly. Another major issue, so that is if the person is having the more duration symptoms, more severe symptoms, etc., etc. So that will require more and intensive line of treatment. Whereas if the person is having less severe symptoms with less duration, that is responsible for the shorter line of treatment as such. So this is what is considered to be the overall idea related to the Kala Samprapti. Now let us understand with this one example. Suppose an individual, so here it's a case history goes like this. A 45-year-old male is presented with breathlessness on doing the cycling in the morning time, that too in the month of May. And since 630 days, he is having this particular presenting complaint. He is also having the pain in the left knee joint from the past 6 months. Identify the Kala Samprapti in this particular situation. Pause the video and think about it. When you think about the understanding, so that is Kala Samprapti is multifactorial. That means we have to think multiple angles in terms of the disease manifestation, in terms of the symptom manifestation, etc. So let us say regarding the presenting complaint that is being present in the morning time, that is indicative of a kapha dosha dominance. Whereas the aggravation in terms of the season, it is being mentioned in the month of May. Probably it is Grishma Rutu. We are going to expect pitta dosha dominance there. As far as aggravation of the age is concerned, the person is 45-year-old male. The age between 30 to 60, that is considered to be the pitta dosha dominant age group. In this way, we are going to say there may be a possibility of a pitta dominance at that particular time period. So here, the food intake, its time is not being specified. Hence, so here commenting on the food intake as such here it is not possible. As far as time in the disease manifestation, in terms of the knee joint manifestation, we are going to say there may be a possibility of a Vyaktavastha. Suppose if that is considered to be associated with knee joint swelling, then we are going to say there may be a possibility of a Vedavastha there. In this way, we are going to analyze the presenting complaints in terms of the Kala. To sum up, the Kala Samprapti, it is being said that Naktam Ninartha Bhuktam Shehi Vyadhikalo Yathamalam. So that is the dominance of the dosha or the severity of the dominance of the symptoms or disease will be categorized by the aggravation of the symptoms in terms of the day or in terms of the night or in terms of the season or in terms of the year or in terms of the food consumption details. So that is deciding the Kala Samprapti. So wherein we are going to determine the possible dosha afflicted depending upon the aggravation of the symptoms that are being observed in these specified time periods. So here the knowledge of Kala Samprapti will be helpful in planning the appropriate line of treatment plus in determining the severity of the disease and the symptoms. Dear ANA community, that is what is the discussion that will be done in this particular video. What are the major key takeaways from today's discussion? Mention in the comment box below. What is the one video that expect to hear in the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget to press the bell icon so that the YouTube algorithms will be fetching you the right information at the right time for the right purpose. That is what is being dealt today. Something more in the next video. Thank you.